Welcome to the Shanae Show, hosted by yours truly, Kavita Channe. Today we have board-certified concierge pediatrician Dr. Edna Tello to discuss COVID-19, how it affects your children, and more.
Thank you so much, Kavita. You're very kind, and I'm very proud and humbled to say I am one of the only pediatricians doing concierge 100% in the comfort of your home. So that makes me different from other concierge services as well.
And I'm sure a lot of people wish that they could have that service or knew about that service right now. It's not many doctors available to do that. And that's really why I wanted to have you on, because to help ease some parents' minds and basically tell us what right now is going around with children. Obviously, we're practicing quarantining. So do you see a drop in viruses, or what is going around at the moment with children and infants?
Well, that's a very good question. Interestingly enough, in pediatric medicine, there are a number of not just infectious issues that can be happening, and only because this happens to be a very special time in history that we're seeing this novel virus called corona. It does not exclude that other things will be going on. I mean, fortunately, and the good news is that I still have beautiful newborn babies coming into the world, but secondary to other issues, they may have problems that land them in the NICU. I also have had injuries and trauma because a lot of little ones are spending more time at home with activities that they usually were not doing. Maybe they're outside a little bit more than they used to be. And so I'm seeing injuries and trauma. And then your usual, what we call the flu season like illnesses. I'm seeing quite a bit of that, just like normal business in pediatrics.
Would you say that the cold flu cases with the children has dropped since we've been quarantining? Would you say it's normal?
I'm actually going to say that interestingly enough, because they're not being tested specifically for the flu, we're seeing what we think is a decrease of flu cases. But I bet that probably some of the cases that are out there, instead of being COVID, could be the flu. We're seeing flu A at the end of the season, as usually we see flu B, or we saw flu B in the beginning of this season. And unfortunately, the symptoms are very similar: body aches or joint pain, fever, maybe some GI like diarrhea or vomiting. So unfortunately, because we're not testing, we're saying, oh, there's less flu, but I feel that some of the stuff we're seeing out there possibly influenza A.
Okay, so then with parents that are having children with these symptoms, and they're obviously not wanting to go to the doctor's office or the pediatrician's office, and they're not wanting to go to the ER, what should they look out for? What's okay to treat at home, and when should they actually make a visit to the hospital if they need to go?
If you see a child going through symptoms that are similar to COVID, fever, body aches, diarrhea, vomiting, I would say treat each individual symptom as you would treat anything else. So if there's fever, treat it with Tylenol, not ibuprofen. That's the only advice I would say against ibuprofen right now. We're seeing that COVID seems to have a negative effect or side effects with ibuprofen. If there's vomiting or diarrhea, alter the diet, increase the fluid intake. If there's body aches, again, use the Tylenol as a way to treat the body aches. What to look for if the symptoms are getting worse, and this is the flu or COVID or any other infectious illness, you would seek medical help. At that point, call your pediatrician and ask for instructions. Or if you are unable to contact your pediatrician for a sick visit, then I would say as things are getting worse, you should contact your emergency room and ask to be seen.
At what point, when a child has symptoms and the parent suspects that it is COVID-19 or coronavirus, is that child able to get a test? Are those tests even available now? Because we keep hearing about tests, yet nobody knows where these tests are.
Well, for the general public, the testing, from the beginning, has to be very, very limited, and they had very strict criteria. And some of the strict criteria obviously did not include or excluded the pediatric age group. They were saying 65 and older, or anybody with an underlying health problem, or even health practitioners and first responders actually were able to get the testing. Fortunately, now we're having more testing, and this is as per as recent as 2 or 3 days ago when I contacted the local emergency rooms. If there's a pediatric emergency, you can contact the emergency room and you can come in, and they will use a different criteria or specific criteria for the pediatric population. When to go to the emergency room. If there is a high fever that you're unable to control with Tylenol. So if Tylenol is not sufficient to keep a very high temperature down, you need to either call your doctor or search help at the nearest emergency room. If there are signs or symptoms of dehydration, meaning a child is vomiting so many times, unable to keep any fluids down, you've already tried Pedialyte, you've already tried other clear electrolyte fluids, and the child is weak and unable to keep anything down, you need to go to the emergency room. If you have a child that is looking incredibly ill, weak, and is under 1 year of age, you need to go to the emergency room. And last but not least, which is very important with Corona, COVID, or any respiratory virus, if a child is having what we call increased work of breathing, meaning that a child is having to breathe so hard and it's unable to keep the ability to bring oxygen. Some of the signs or symptoms: nasal flaring, the use of additional neck muscles. If you take your child's shirt off and you see that they're using rib muscles, if they're sitting in a certain position where they're, again, looking like they're short of breath, or if they're breathing so fast that they're unable to eat or drink fluids, that means they have increased work of breathing and they need to be seen in the nearest emergency room.
Wow, well, we hope it doesn't have to get to that point for anyone. Have you had any patients, young patients, that are testing positive for COVID?
So far, I have to say, Kavita, the little ones in the pediatric age group, and including their parents who have shown signs and symptoms of a respiratory illness consistent with COVID, so far are doing well. I have been following them clinically, meaning that I'm treating each symptom accordingly, and we have not have to go to the emergency room at this time, on this day. So I'm very happy to say that, but it doesn't mean that things may not change in the next couple of weeks.
In order to keep your patients safe, you have to be healthy. So maybe what advice can you give out there to other pediatricians?
Well, this is definitely going to change the way we practice medicine in general. I am very fortunate, very blessed that I have a very good rapport with my patients as it is, that we use and try to maximize the use of technology to communicate. There are certain things that are just, we're not able to fully evaluate just through telemedicine, particularly in pediatric medicine. I mean, imagine a 2-year-old, how are they going to evaluate ears or throat? So I'm still having to do what a pediatrician usually does. I am using protective equipment, PPEs, as we are recommended to do. I'm using masks, goggles, gowns, gloves. And I do this also not only to protect myself, but to protect my patients. There are limitations, obviously, to, as I said, to telemedicine, and something to look forward to, which I think is going to come very, very soon, is the ability for me to use cameras or certain virtual devices that can allow me to look at ears and throat in a remote fashion. So that is coming up. It's coming up. It's not a promise, it's a reality.
Dr. Tello, how is this affecting the hospitals? Do they have enough supplies?
That is the question of the day, right, Kavita? I mean, they keep promising, the administration of different hospitals keep promising that there will be sufficient PPE. They are using some of the stocks that are in each hospital for the critical care units, being the pediatric ICU or PICU, or in the neonatal ICU or NICU. So these are critical places where there's not a shortage, but they're definitely being very conscientious. And the emergency room gets a little difficult and challenging. As per the report, nothing official, is that they're having to ration per shift. So they'll give to nurses for every shift a new PPE that they actually have to reuse through the entire shift. So there's a shortage, which is the reality. A lot of administrators are working, furiously to get their hands on the stockpiles that we hear that are available. But I'm going to say, on a good note, I mean, literally this morning I was contacted by a patient who said, Dr. Tello, we have thousands, maybe close to 1 million masks coming in. Give me the contact information. And, I'm in the process of putting them in with the right people so they can deliver something to the nearest hospital. So we hear a lot of bad news, but I also tell you there are a lot of good people out there doing the right thing. There are people in our community, from my local church to my neighbors, literally to some of the local nurses that are retired, sewing masks for the people in the emergency rooms, out in the tents, for the technical people who do radiology, who take vitals, who do triage. So there's a lot of good things that are going on right now, and I'm happy to say that let's not be discouraged. It'll be available.
Moving forward, now that we've gone through this and we know that supplies are limited, what are some necessities that every parent should have on hand in case anything like this or any type of critical time occurs in the future?
I said one of the first things that we have to learn from this experience is that we cannot sit and wait for either authorities or the government to solve these issues. We have to take matters into our own hands. I would say do not act out of panic, but just like you prepare for hurricane season, I said we should prepare for flu season. We should go through our little medicine cabinet and make sure that this is even for when you're going on a long trip, on a vacation, or before you're preparing for your flu season, make sure you have Tylenol. In this case, we're not using ibuprofen, but you should have all your fever reducers. You should have over-the-counter medications for mucus and coughs, and Benadryl, which is for anti-allergy. You should have first aid kits with things like Neosporin, bandages. If your child or yourself are diagnosed with any chronic condition, make sure that your medications are up to date, that you have all the right dosing. Particularly in pediatrics, you have to have all the right dosing according to their weight. Make sure that your children are vaccinated. I am a fellow of the American Academy of Pediatrics, and I do believe in the protection of vaccinations. It's good science. And then there's nothing better to prepare yourself for any crisis as to remain and have a healthy lifestyle. Make sure you're exercising, your child is exercising, you're taking your vitamins and your supplements. You have a healthy dose of just fitness every day and meditation and something good for your body. So those are ways to prepare.
What advice do you want to give new moms out there who are now having to quarantine with a newborn?
Wow. Have a good support system, because you're going to need it through this, whether it's your spouse or your parents or people in your family, have a good support system. Again, one more time, make sure you're getting your rest, you're taking your prenatal vitamins, you remained positive and encouraged. We need a healthy mom, a strong mom to have a healthy newborn baby, and take the self-quarantine seriously. If you have a newborn baby, really limit the number of visitors and people that, if they're not directly helping you, they don't need to come and visit. Obviously, this is not a social time for anyone, but particularly for a new mom and a newborn baby.
Thank you so much, Dr. Tello. This is such awesome information that everybody needs to know, even if they don't have children. This is useful for all adults as well. We appreciate it so much, and can't wait to have you back on again.
Thank you so much, Kavita, for the work that you're doing. Thank you, thank you. I love your posts. I love your videos. You walk the walk. You talk the talk. You live a beautiful, healthy lifestyle. I love your spirit. Thank you for everything you're doing.
Thank you so much, and I know you're helping so many families, so we appreciate you so much for helping our community.